What does it mean when you have pain on the side of your shoulder? In medical terms, we call this the lateral shoulder area. A lot of my patients have pain in this area, and it can come from several different causes. In this video, we will discuss 3 common causes of pain in the side of the shoulder. If you are new to the channel, welcome. Our goal is to educate people about the latest and best in shoulder and arm care. So let's start off by discussing what is in this area. The lateral shoulder is covered by a large muscle called the deltoid muscle. The deltoid originates from the collarbone and the area of the shoulder blade called the acromion, this bony projection right here. Under the deltoid and acromion, you will find a set of muscles called the rotator cuff. The most important of these muscles is called the supraspinatus muscle. It is also the tendon that has the most issues due to its anatomy. This is a tightly packed area known as the subacromial space. This space also has a fluid sac known as the subacromial bursa. It is an area where many patients have a prominent bone projection, either due to normal anatomic variations or due to degenerative conditions like arthritis. One last thing I'll point out is this bony projection of the humerus called the greater tuberosity. It is a normal shelf where the supraspinatus inserts, but in certain conditions it can come into contact with the roof of the shoulder. So number 1, impingement. You may have heard of impingement syndrome before. This is a condition where the supraspinatus tendon gets pinched between the humeral head and the acromion as the arm is raised. Due to the shallow socket of the shoulder, the normal humeral head up and down motion is about 2.5 millimeters during activities. The surrounding muscles help to limit excess movement. However, with muscle pain and incoordination, this up and down motion can become excessive. Also, if there are any bone spurs or other abnormal bone shape, the shoulder is less tolerant to any excess translation. In impingement syndrome, the supraspinatus tendon gets pinched between the greater tuberosity, that bony projection we talked about before, and the acromion, leading to tendon irritation and pain. Like most tendon issues, this often starts as an inflammation of the overlying bursa that can be reversed with rest and a focus on proper mechanics. I usually prescribe physical therapy for this condition. Anti-inflammatory medications can also be helpful. Number 2, partial thickness rotator cuff tears. Now, if shoulder impingement continues, the underlying rotator cuff can start to accumulate damage. As I mentioned before, the supraspinatus tendon is the most commonly involved tendon here. The supraspinatus commonly gets damaged on its upper surface. However, it can also form damage on the undersurface or the interior part of the tendon. This type of damage is rarely a full disconnection of the tendon from the bone. So even so, this can become quite painful as the tendon becomes more and more damaged. In some cases, physical therapy can help to at least stop the problem from getting worse. By restoring proper mechanics, we can often reduce the amount of rubbing or impingement of the rotator cuff. Unfortunately, if the tendon damage involves a significant portion of the tendon's thickness, the shoulder may remain quite painful, making overhead activities and sports difficult. An MRI or an ultrasound can be helpful in delineating how much damage has accumulated in the tendon. For patients with persistent pain, I offer newer therapies such as platelet-rich plasma plus or minus hyaluronic acid injections. These injections have been shown in studies to promote healing of chronic partial tears of the rotator cuff. The tear pattern matters though, and these injections don't work for all types. In high-grade partial tears, we usually offer patients a surgery where we place a collagen patch on the damaged area. This can be effective at restoring the integrity of the tendon. I've previously done a video on some of the new options available for partial thickness rotator cuff tears. I'll place links below. And lastly, number 3, full thickness rotator cuff tears. In many cases, the rotator cuff can be fully torn. Sometimes this is due to a trauma such as a sports injury, and in other cases it can be due to a progression of the conditions we just discussed. A partially torn tendon can be easier to rupture during what might have been a normal activity such as weightlifting or a tennis serve. With a fully torn tendon, it is usually painful to raise the arm up through the mid-range of motion. That's referred to as the painful arc. Some people describe the pain as a dull, achy pain right here and even down lower. There can be an associated crunchy sensation as the greater tuberosity rubs against the roof of the shoulder. Many people can compensate for a torn rotator cuff by recruiting the other muscles of the area, such as the deltoid, or the other uninjured muscles of the rotator cuff. So we often prescribe physical therapy as a first step. Even though we know physical therapy will not make the tendon heal, it can often help improve the mechanics and function of the shoulder. As far as options go, here are some things to consider. Rotator cuff tears don't always require surgery. However, without surgery, they will not heal on their own. Rotator cuff tears are known to increase in size as time passes. In some cases of large rotator cuff tears, it can become very hard or even impossible to raise the arm. Once a tear becomes a chronic rotator cuff tear, they can become difficult, if not impossible, to repair directly. Over the course of several years, the tendon and muscle lose their pliability due to scarring and atrophy of the muscle. So for these reasons, For healthy and active patients with a full rotator cuff tear, a surgery might be the best option. We can perform the surgery arthroscopically, which is a less invasive approach. For those who have underlying medical conditions, surgery may be a second or third choice. It is best to consult with an orthopedic surgeon if you think you might have one of these conditions. In a future video, I'll discuss the latest methods for repairing rotator cuff tears arthroscopically. Please subscribe if you'd like to learn more about the best in shoulder and arm care. Also, since you've stayed with me until now, I asked AI to write a song summarizing the most common causes of lateral shoulder pain. Enjoy.
Shoulder impingement for sure. Bigness tears rotator cuff tears. They cause pain in the outer shoulder.